We join, we listen from your results. And now we can listen on the hold on.
Sri events, can you make either me or Dr. Deepa Tangamani madam as co-host? So that if somebody is there, we can just mute it. Can you do that, Pa?
Chitrakala.
Chitrakala, let us. Sri events is logged in, madam. Sri events வந்து யார்ப்பா login பண்ணிருக்கீங்க? Priya?
Priya. So Priya, 23 purples have joined. Shall we start?
Anybody presenting?
No one is answering. Everyone, please unmute.
Epsiba madam is missing.
Oh, I am not.
இருக்காங்க madam. Not on madam. Madam oda network is little poor. So madam
இருக்காங்க.
Hi ma'am. Ma'am, video off பண்ணிக்கோங்க madam. Epsi ma'am.
ஸ்டார்ட் பண்ணுங்களேப்பா.
Start பண்ணிடலாம் ma'am. Priya, start.
Okay, ma'am. So good evening one and all. So we welcome you on behalf of Oxy to the clinical webinar series. This is on behalf of the Oxy's Clinical Research Committee. Today we have a very interesting topic about the thesis discussion in the PG exams. So whenever you go for exams, so we have our examiners around and we are asking the PGs like, what will be the discussion? So what the examiners expect? It is about the examiner's perspective and what do they really expect from the PG, or like what are the things which you are expected to tell in the exams. And follow this, we will have a quiz on basically about all the research topic on Kahoot platform. So like, thank you and warm welcome to everyone who's joined. It is a pleasure to have Dr. R. Premlata madam, Dr. Hepzibah madam and Dr. Uma madam. So welcome all of you madam. Thank you. Deepa madam, do we have the CVs?
Okay. Chitra, I think we have a CV.
Yes ma'am. 1 minute ma'am.
Yeah.
Any student presenting ma? Any like thing?
Ma'am, it's just like a discussion, general panel discussion kind of things. What we will be starting, and you tell your experience as an examiner.
Thank you for this. So,
one of them can share their project. One of them can talk about their project. Then we can start asking on.
Ma'am, that is what, ma'am, the thesis, they cannot able to share it now, only during the exams. Before, share it in the exam.
They can orally, they can say, no, suppose
any of the exam points are there, you can just, come back and have a discussion.
That we can
madam, any of your PGs have joined, madam? Uma madam? Uma madam, any of your PGs have joined, madam?
Unmute, Uma, unmute பண்ணுங்க.
All our senior PGs are gone for exams. From tomorrow they're starting exams. So we have a very junior PGs.
Okay, but anyway, at least
year PGs have asked to join.
What is the topic and what is their outlook?
No, they would have selected their topic, no ma.
Yes, ma'am. Yes.
Tell the topic.
There is one girl here. I'll just ask her, madam, if she has got. She can join. Only one of them has a topic. All the others are very new.
Anybody from IOG, KGA, second year students? Ma, second year PGs there? MD PGs, MS PGs?
Yeah, IOG PGs must have joined, Leia. IOG PGs.
You just say, somebody start telling how do you select your research question, research or thesis? Anybody?
Okay, the first question you will be
just tell the topic, ma. Just tell the topic. One of the PGs, Fariya, are you available?
Fariga, they are diploma, they don't have a thesis.
Madam, we don't have a thesis. So that is the thing with our PGs. But
DNB candidates only have the thesis, no?
Balaji, have you selected some topic? Balaji?
Dr. Ragapriya, you are from RSRM,
Hello,
right?
Yes. Hello, ma'am.
Dr. Balaji, yes, we can hear you.
Balaji.
Hi.
Yeah, Balaji is responding.
I've been given a topic and I'm doing it from second year.
So tell us the topic which you have selected and what criteria.
Tell us about your topic.
Thesis title.
What is your aim? What is your objective?
Ma'am, my topic, ma'am, could you hear me, ma'am?
Yeah, tell me.
Yeah, loud and
Yeah,
clear.
we are
but-
hearing. Tell doctor.
Ma'am, 1 minute, ma'am. I have some issues. 1 minute.
Dr. Ragapriya
Yeah,
is
you can
also
go.
there. Dr. I just
Ma'am, hello.
Yes, sir. Yes, we can hear you.
Ma'am, my topic
Yes,
is,
doctor.
comparison between two suture materials, ma'am. Polyglactin, that is vicryl, and barbed in vault closure during laparoscopic hysterectomy.
So
Okay.
what is
What
your
is your
actual
We're not
name
hearing
of the
very well.
study?
Comparison between
Vicryl and
Com-
barb
between
suture.
Bob
suture.
suture.
Yes, ma'am.
What is your aim of the study?
Ma'am,
That
aim
is
is
your
to
heading.
primary
Is it your
outcome.
heading?
Yes, ma'am. Hello, ma'am.
Primary. What's the primary outcome?
Primary outcome is to compare the time taken to close the vault between the two sutures.
Yes.
Close the
Okay.
wall.
Then
Okay.
any other secondary outcome?
Secondary outcomes, I have
You are going to
comparing the
analyze any secondary outcome?
yes, ma'am. Comparing the complications, ma'am, like any complications like
Yes.
surgical infection, wall dehiscence, a post-operatively pain, how is the pain for the two sutures, ma'am?
So what was
Okay,
it your study?
wonderful, wonderful.
What was your study design, doctor?
Mine is a randomized control trial, ma'am.
It is a comparative.
Comparative study.
No. How do you randomize? Balaji, how will you randomize?
Ma'am, I have actually
It is a computer
we
method.
have two things, ma'am. I am an observer, and my surgeon, my guide will be the doing. I mean, the surgeon who does the suturing, ma'am.
Yeah.
So
That is agreed. No. How do
How
you
was
randomize this?
randomization done?
I have generated a computer
How do you
generated
randomize?
randomized. We have two groups,
Yes.
and I
Computer
have
generator. Right.
computer generated randomized numbers, ma'am. My total numbers is 52, 26 in
Sample
each group.
size.
Sample size 52, ma'am.
Okay.
26 in each.
52
You are
in each
biased?
wing.
Ma'am,
Each-
hello, ma'am.
Each arm 52.
No,
Each arm
26, 26.
26 each, ma'am. So total 52.
Total is
See,
52. Okay.
No. You are a observer. Who
Yes,
is
ma'am.
randomizing the person?
Actually,
You're not supposed to do it.
since I am the observer and I am allotting the suture material, I am not blinded, ma'am, but my surgeon is blinded, because on the day of surgery, I will I will tell the group, ma'am, whether this patient belongs to vicryl group or barb. During the surgery, then my surgeon will do the suturing.
Why can't your co-guide or somebody that there is a little bit of bias, if you know the person, you can choose.
No, ma'am. I have
If
already
you
generated
choose
the
that-
computer generated sequence, ma'am. First patient, I will allot. I have already the sequence of suture material for all the 52 patients, ma'am. The first patient, I have to give this suture.
Alternate
By
patient.
numbers you give them, right? A, B sort of thing, right?
I will give A, B, ma'am. A is for vicryl, B is for barb.
But you
So
know
that
A is vicryl and B is for barb.
But no, you should be blinded, doctor. You should be blinded. You should also be blinded.
Ma'am, actually,
know,
since I
no.
The surgeons may know, but you should be blinded. I do not know how this has worked out in your favor.
okay, ma'am.
You have finished your ethical clearance,
Yes, ma'am. Yes, ma'am.
Dr. Balaji. You have finished. They are okay with this sort of.
They told it's okay,
Your
ma'am.
ethical committee said okay.
Okay, ma'am. Because since I am not doing anything, I'm just observing. Because my surgeon is going to perform. The surgeon does not know what suture she is going to use.
You are going to analyze. No, you should also be blinded. Somebody else should have done a randomization. Then it will be
It's blinding, because the computer generated sequence is already done, ma'am. For all the 52 cases, already it has been done. For first case, what is the suture? Second case, what
Okay,
is the
doctor.
suture?
The A is going to vicryl, the B is going to barb suture. Right?
Yes, ma'am.
So
Yes,
you
ma'am.
can allot, if you know someone and if you know this is going to be good effect, you can allot like that, no? Yeah.
No, ma'am. I won't allot that way, ma'am. Because already it's like enrollment, ma'am. The first patient enrolls, the first number goes to A group. So already I have allotted, I have generated the sequence for the 52
Okay, at
numbers.
the same time, two patients are coming. Two
Yes, ma'am.
patients are coming for the same type of surgery.
Yes, ma'am. No, ma'am. Actually,
will you allot?
I've allowed by like during like the time of admission, ma'am. Like first patient admitted, the first patient going for surgery today. The mostly we won't do two TLH on the same day, ma'am. So like even though if we do it, it will be like first patient first and the second patient will go for the second group, ma'am. I mean the next number.
Okay.
Okay,
How did you
Deepa is
calculate
asking,
the sample size?
Deepa is putting in the chat box whether in the exam statistics asked much. She has asked.
No. This case, he has specifically told randomized control study. So
Yes, ma'am.
definitely people will ask. Okay, you cannot just like that take it for granted. They will not ask statistics. Definitely they will ask sample size also. How did you arrive at sample size? There are so many formulas are there. And you
Yes,
have
ma'am.
to clear, especially MD-PGs and all, they have to clear the research methodology.
Okay, ma'am.
First year itself. That also you have to find out, doctor, from satisfy.
How did you collect the sample size? Based on, how is the
Based
sample size usually collected? It is based on the?
it is based on my parent article, ma'am.
Prevalence.
It is based on the, and the primary
Yes.
objective,
Yeah.
basically.
Yes, ma'am. And we had a scientific committee also before the ethical committee.
Yeah.
That we had guidance from our scientific member.
No.
They
Lila, you have to know the formulas, doctor, little bit of formulas, because they will guide. But
Ma'am, they don't ask so
exam,
much in
let them-
details, ma'am, the formula and all that.
No, let them know what basis they are collecting the sample
Yeah,
size.
he can know it, ma'am, but
From the
yeah, he
parent
should know
article,
it.
from the parent, a parent article, because and the primary objective, and sometimes depends upon the prevalence. So many things are there. These are all the basic things, no? They have to know.
When
Okay,
you're
ma'am.
Because
when you're taking when you're talking about the time, the primary objective, it depends upon other confounding factors like obesity, whether she has a Paris woman, previous surgery, and all. Have you taken any confounding factors into account in the final thing?
Ma'am, yes, ma'am.
Including and
Actually,
excluding factors, yeah.
my
inclusion criteria.
Inclusion criteria, exclusion criteria. What have you taken?
yeah,
Nothing,
like,
madam, is that what you want?
Yes,
exclusion it made only malignancies have made, ma'am. Like all malignancy have not including into the this thing, ma'am. Into
Inclusion
my
criteria is only malignancy.
exclusion criteria, ma'am.
exclusion.
Okay, exclusion is
Exclusion
malignancy.
criteria.
All other cases are included.
We are included, but I have included all the factors. Like only at the arrival of the final statistics, I could be able to tell like there is any confounding factor because I am in the between of the study. But I am taking into consideration all this age of the patient.
I wanted the confounding factors whether it has been taken into account.
Cesarean, endometriosis, and all
Yeah.
other factors I'm taking into account. But only at the arrival of the statistics, I would be able to tell whether that influences the time taken difference, ma'am.
Dr. Balaji, have you made a study design? If you have done, you would have already listed out inclusion criteria, exclusion criteria, everything, right? Before you go start your study. So we
Yes,
want to
ma'am.
know what it is.
Morbid exclusion criteria, we have taken morbid obesity and malignancy I have excluded, ma'am. Other than
Okay.
that, I have excluded everything.
So everything else is included, right?
Yes, ma'am.
Everything, irrespective of BM, morbid, you said, yeah. Okay,
Morbid
fine.
obesity, I have yes, ma'am.
Morbidly obese, she has, overweight and all, he has taken the same thing. Whether
Yeah,
overweight
he's
or
taken that.
We had one case that was a case of Glanzmann thrombasthenia, but we diagnosed it after the surgery only. Patient had vault
Okay.
collection. Then we came to know because her PTNR was normal, still she was having bleeding PV. Then we came to know she is a known case of Glanzmann, but she didn't tell us. And then I need to take that patient out of the trial because before that she was in the inclusion criteria. Later on, I decided I should not include because she's come under the special that will have a confounding factor. So I've taken out from the trial.
Okay, Dr. Balaji, now that you have chosen this topic, why did you choose this particular topic? And what is your research question or hypothesis, if any?
Ma'am, I have chosen because I've been 2-3 topics have been taken into account, and my guide asked me to specifically go for this one, ma'am. Then
Your guide asked you to do it. Okay.
When we talk about a research question depends upon your review of literature, the knowledge about the clinical practice, and
Yes, ma'am.
justification for taking that. Why should we
Uh,
use this? At the end of the day, by
Yes, ma'am.
that research question, what do you like to derive
Address.
it? Yeah.
This is to mainly to compare the time taken between the two materials, so that this and according to the literature, barbed suture it's far easier to perform, and it takes less time to close, ma'am.
Yeah. So your null hypothesis says bar sutures are shorter time. So you want to know whether
Dr. Balaji, we already know this, isn't it? We are
Yes.
not making knots in the suture, whereas your regular vicryl, you will be applying knots. So this is
Yes.
something which we already know. It's going to take a shorter time.
Okay.
So what is new in your research thesis? That is what is important, isn't it? Anything new you are going to derive from your thesis topic. How it will
Ma'am.
help later in your future practice. So you need to prove something new. We already know barbed is a quicker method than your regular vicryl.
Just want to prove the complications, ma'am. If we
Then
if
your
I may-
primary objective was only time, right?
No,
Your secondary
primary
objective only is a
objective
complication.
only- No. For him, primary objective is the time taken, but other things also he has included.
Yes,
Any
madam, but his
complications-
primary objective is already a known conclusion.
actually,
No, even if it is known hypothesis, he can also endorse it. That is
Yeah.
not a problem. Other things
When you
also
went
he's
through
doing.
literature, have similar studies been done?
yes, ma'am.
Probably you would have done.
Searched for previous articles, ma'am. There were in India. There is no randomized trial for this,
Okay.
ma'am. And I've included the cost also, ma'am, because barbed is little
Yeah.
costlier than the vicryl. At the end of the thesis, when we calculate with the cost and the time taken, we can even in foreign countries they even they calculate cost for the time also. Like when we close it earlier, the cost for the surgeon, cost of the theater, everything.
No, not only abroad, doctor, here also the time taken for theater, it is charged. For 1 hour it is, 2 hours it is. So the cost effectiveness also you have included.
Since ours is a government institute, we don't go into the timing, but still I've included the cost where barbed is costlier than the vicryl.
Okay. Can you tell us about the methodology you're using for your thesis? Everything in details. What do you understand about methodology of a thesis, of a research?
How to allot group into two groups, ma'am. The candidates.
The study design, the sample size, how you collect. So
Prospective
can you
study.
describe for your research?
Yes, ma'am. This in my case, whenever a patient enrolls for hysterectomy, who's planned for total laparoscopic hysterectomy, I will randomize it. Already I have a generated sequence. With that, I'll randomize the patient into the group, ma'am, whether she will fall into vicryl or barbed. Then I'll use the inclusion and exclusion criteria, whether to include or exclude the patient into the trial.
Okay.
Then generally I used to tell my surgeon, the guide, whether she falls into which group. Then my surgeon, the guide, used to perform, and somebody will be the timekeeper in the operation theater, either the vaginal assistant or mostly the anesthetist, ma'am, because they'll be able to record the time.
Okay, Dr. Balaji. So what all does this methodology contain? What all should you do? Just tell me, not in relation to your research. What do you understand by it when you're conducting your research? So it tells you what is the type of research you conducted. So in your case, you're doing a case study, randomized controlled?
Randomized prospective case.
Randomized prospective, yeah. Okay. Then you must mention how you collect your data, which you have already told. How
Yes,
you
ma'am.
collect your data. From where did you collect? The population you collect from. Okay, when
the
they get admitted and you go through their case sheets, you
Yes, ma'am.
randomize them into a particular arm. Okay.
I have a
And then
basic
how did you-
question. Does the surgeon the same surgeon for all cases or is it different? So one of the
One
factors.
for all the cases as of now,
Pardon?
because 52 cases, I have got a very good number. It's not so high, so that I hope that because when multiple surgeons are involved, then again the confounding factor will come into play.
That's what I'm asking. Are your selection is in your criteria? Is it the same surgeon or it is a multiple surgeon? Because that is an important factor in time. A
Only one
surgeon may be slow.
Only one surgeon.
Only one surgeon.
Ma'am, can you go to a
Are you
next
getting
slide?
an informed consent from the patient about the trial?
Yes, ma'am. Yes, ma'am.
Ma'am,
No,
can we move on to the next
no,
candidate?
I think this is a clinical trial. It is not a clinical trial. It is a
No, ma'am.
comparative study. Clinical trial,
Comparative.
something suppose
Already
Bob
both
suture is
materials
the
are
first time you are doing it, you have to register in the clinical trial. You have to register also. It is not a
I have
clinical trial,
registered
it is
from
a
the start.
comparative study. But
Yes,
all this thing you have to register, but it is not a clinical trial.
yes, ma'am.
It
Yes,
is a
ma'am.
comparative
In
study.
PTO, registered
Sorry,
already, ma'am.
clinical. Ma'am, can
Since
we
it's already existing suture materials, it won't come under a clinical trial.
It's not a clinical trial. Already it's proven.
Yes.
So, ma'am, can we have another candidate to go ahead with the
Okay,
discussion?
pa. One more candidate with
Dr.
the
Rajapriya,
Balaji from which college, pa?
Ma'am, Southern Railways, ma'am.
Okay.
Very
Yeah.
nice, doctor. You did a
You
very
have
good
done a
job.
Biryani.
good job, doctor. You have understood the topic and you have done
Good,
well.
good.
Okay, keep it up.
Thank you.
Do
Thank
some
you.
more research on another topic which you like
Yes.
it.
Thank you, ma'am.
Dr.
All the best.
Rajapriya,
All
will
the
you
best.
like to join the discussion?
Ragapriya.
Ragapriya?
Yes,
From
ma'am.
which college?
From
RSRM.
Stanley. Yes, ma'am.
Stanley, RSRM Stanley, madam.
Okay.
Good evening, ma'am.
Yeah.
My topic, mine is a prospective observational study, role of early trimester uterine artery Doppler in predicting adverse outcomes later in pregnancy, ma'am.
Prospective observational.
Yes, ma'am.
Early pregnancy Dopplers in
Predicting adverse outcomes,
adverse
What
outcomes.
are the outcomes you are looking for?
preeclampsia, IUVR, and oligohydramnios, ma'am.
No. What's your heading, doctor?
Role of early trimester uterine artery Doppler in predicting adverse outcomes of pregnancy, ma'am.
Do you mean first trimester, early trimester?
Yes, ma'am.
This is how you have headed your
Trimester,
thesis?
doctor.
Yes, ma'am.
Early trimester.
Yes, ma'am.
It will be better as first trimester.
Okay,
At
ma'am.
what period of pregnancy you do it along with the NT scan you are doing,
Yes,
ma'am?
ma'am. Along with NT, ma'am. 11 to 13 plus 6 weeks, ma'am.
Okay.
So,
So
no,
just
your
like-
heading, can you redefine your heading? You have got that ethical clearance?
Yes, ma'am.
What's your heading?
Role of early trimester uterine
Role
artery
of-
Doppler.
No, you
Hello.
cannot do
Ma'am,
Doppler
role
at
of
6
first
weeks, no.
trimester Doppler,
Early
ma'am,
pregnancy-
predicting adverse outcome.
No, doctor. They have to spell out the gestation age. That's what I feel.
Okay, ma'am.
They won't do at 6 weeks, 8 weeks, 9 weeks. Early pregnancy,
You mean the first
From
trimester
when to
screening,
when?
right?
Yes, ma'am. 11 to along with
Right.
NT scan,
Along with
ma'am.
the NT scan, they do, madam. That's
Yes,
what she
ma'am.
said.
So specify. Don't say it as early trimester. You will have to very
better.
clearly.
Early scan means it is very vague, no?
Yes,
Yeah.
ma'am.
This is called first trimester screening. So just put it as first trimester Doppler, okay?
Yes,
Change
ma'am.
it.
Yes,
Yeah.
ma'am.
Okay. Your primary objective is what you have stated. What is your secondary objective?
Determining the sensitivity and specificity of uterine artery Doppler in predicting preeclampsia, ma'am.
The first is adverse outcome. Second
I
is
think,
preeclampsia. It's the same, isn't it?
No, primary outcome should be prediction of preeclampsia. Secondary outcome, you can say whether it is going in for preeclampsia, preterm, all those things. No, IUGR, FGR.
Yes, ma'am.
No, what is your primary outcome, you tell, Pa?
-2.
Are you in your first year, Ragapriya?
No, ma'am.
Second year?
A final year, ma'am.
Final year. Okay.
Tell the
So your
primary outcome,
thesis
Pa.
protocol has already been accepted, right? You've already sent in your thesis?
Yes, ma'am.
Okay. What have you labeled?
Yeah,
What have you given as your stated as your primary objective? What is your aim? What is your objective?
Aim is to evaluate the efficacy of first trimester uterine artery Doppler in detecting adverse outcomes later in pregnancy,
No,
ma'am.
efficacy, whether it's sensitive or how sensitive it is to detect adverse outcome is her primary objective. Secondary objective is
Mhm. Okay. So you have collected how many patients? What is your
One-
sample size?
110, ma'am.
Your data must be done, right?
Yes, ma'am.
Okay. So what have you inferred from it?
Pulsatility index more than 2.3 was associated with preeclampsia and IUGR, ma'am.
Hmm.
But there
Which
was no,
pulsatility index of?
ma'am,
Uterine artery must be specified.
You must
Uterine
tell
artery
complete. Uterine artery
ma'am.
pulsatility PI. Yeah.
Yes, ma'am.
More than 2.3
Yes, ma'am.
is associated with?
Preeclampsia and IUGR, ma'am.
just say whether it's early onset FGR or late onset
Early
FGR, ma,
early
not
onset.
IUGR, ma.
She
Yes, ma'am.
hasn't done that.
Early onset FGR and
Okay.
preeclampsia, ma'am.
Hmm.
There was no significant difference in oligohydramnios, ma'am.
Significant oligoamnias as well.
No significance
No
in
significant.
detecting
Okay. So
oligo.
now that you have got all this data and you have come to an inference from it,
Yes,
how
ma'am.
do you propose to apply it to your clinical practice?
ACOG does not recommend starting aspirin based on first trimester Doppler so far, ma'am.
Hmm.
When we detect incidence of early onset FGR and preeclampsia based on uterine artery pulsatility index, we can start aspirin from before 16 weeks, which will help in remodeling of uterine arteries, ma'am.
Hmm. But I think most of us are doing that already.
Yes, ma'am. But
No, but detect
Your parent
abnormality,
article,
do
what
you
did it say?
prescribe aspirin or not? Whether you were able to prevent it after diagnosing the pulsatile index,
yes, ma'am.
advise aspirin, and whether how many of them you are able to prevent it. Development of
See, all women who have been exposed would have been started on ecosprin. So it's very difficult unless we have two groups,
aspirin.
one with the drug, one without the drugs. We cannot say how many percentage have been.
How did you choose your patients? How did you include them in your study?
All
All.
antenatal patients between 11 to 14 weeks were included, ma'am.
Everyone? Exclusion?
Exclusion is chronic hypertension, connective tissue disorder, renal disorders, and multiple pregnancy, which are the groups where we give aspirin.
You okay. You give them aspirin anyways, right? In the
Yes,
beginning
ma'am.
itself.
I excluded them, ma'am.
Okay.
Oh,
So
you
now
have-
after
You
seeing
have done
this,
110 cases.
Yes, ma'am.
You have done 110 cases. How many of them have had increased pulsatile index of uterine artery? Out of which, how many of them developed preeclampsia? How many of them you gave aspirin? Having detected high PI, you left them
Yes,
like
ma'am.
that? Why? That is unethical, no?
No, is it like retrospectively you saw that their PI was less and somebody has not done it, or you have done it prospectively, doctor?
Prospective study, she says.
She has done prospective observational study. Having found out it is increased, is it worth leaving them without aspirin?
Ma'am,
did you have a cutoff for uterine artery PI?
Yes,
After
ma'am.
which you would start aspirin or anything?
In percentile, or you are telling always in the PI?
Ma'am, moms, ma'am. MOM. Or anybody above the 95th percentile, did we start aspirin?
Yes, ma'am. Above
90th
Were they
90.
percentile,
were they
we are
included in your
start.
study? If it
No.
showed above 95th percentile? I think you can
We
make two arms actually, one above 95th percentile and one normal. And then which
And
of the two
below.
in both the arms would have gone for preeclampsia, FGR, you know, and
Preeclampsia.
then it would have given us a better outcome for your study. So we could use it later in our practice. You didn't do that, right?
No,
It was
if
just a
it is
prospect.
above the 95th percentile, automatically all women would have get aspirin, no, in your study. Are they
Yes,
given
ma'am.
or
On the
not? That's what.
95th percentile, we have started aspirin, ma'am. From 50 to 95, we have followed in the second trimester, ma'am.
Uh-huh. Okay. And what are your what is the number of people, number of women who had preeclampsia, FGR? Statistically significant results did you get?
Yes, ma'am. In
At which
preeclampsia,
PI did you get statistically significant results?
1.5 was 50th percentile, ma'am.
Okay.
More than 50th percentile,
Ah,
there was 11 cases, ma'am,
okay.
of which 8 developed IUGR, ma'am, and
Okay.
6 has gone in for preeclampsia, ma'am.
So all that 11 women did not have aspirin. Am I correct?
Yes, ma'am. 50th to 95th
So
percentile.
no, that's what I'm telling. We are see when we say that the cutoff is 2.3,
Yes, ma'am.
without intervention or with intervention, unless we do, we cannot say whether aspirin has decreased like that. If you are going to say only after 95th percentile, we are taking a patient on aspirin. Am I correct?
Yes, ma'am.
Okay. So that group, did anybody develop preeclampsia, FGR, ma?
Yes, ma'am. There were 34 cases.
All the
of
34 had
all were
aspirin in
started an
spite of it?
aspirin.
Even after starting aspirin, huh?
Yes, ma'am. Even after starting aspirin, in the second trimester, only 16 had increased pulsatility index, ma'am. Other 18 had normal pulsatility index after starting aspirin.
So what is the conclusion of your study?
Aspirin could
After comparing literature,
Yes,
what
ma'am.
did you infer from it? After you compared literature?
Currently, we don't have ACOG recommends. ACOG does not recommend aspirin based on uterine artery pulsatility index, ma'am.
Mm.
We can start it when it is more than 50th percentile itself, ma'am, from first trimester Doppler.
From your study, this is what you are telling us.
Yes, ma'am.
You can start it as soon as it touches 50.
Yes, ma'am.
Okay. Madam?
Is it like, have you listed with patients with the risk factors, other risk factors such as your age, your your twins or
Yes.
anything you have included, divided them based on that also?
Yes, ma'am. Multifetal pregnancies we have excluded, ma'am. Based on priority and based on age, we have categorized, ma'am.
Okay.
All the moderate and
What
high
are
risk
all your
factors in the
inclusion
initial
criteria?
booking you have excluded.
Yes, ma'am.
No, inclusion criteria.
All antenatal mothers between 11 to 14, ma'am. Exclusion was chronic hypertension, renal disease, connective tissue disorder.
Exclusion we already told.
Yes, ma'am.
So, elderly,
Primary,
all
multi,
those
you
people
included
with
all.
the high.
Yes, ma'am.
All, irrespective of the parity and age, it has been included. That's
Yes,
what she
ma'am.
said.
Yes, ma'am.
Okay.
Okay, ma'am. Primaries and elderly, they fall
Madam,
under
the
the
study
high risk group. So we
she
start
has included.
postpone anyway. Anyway.
So they are the confounding factors for a
Yeah.
primary gravida, elderly lady.
Yes, ma'am.
That has been not taken.
Kind of difficult, madam. Though we say if you have to study, but we cannot stop without starting aspirin. So, and anyway, like Aspire trial says it prevents a severe preterm preeclampsia, but doesn't say that we can totally prevent preeclampsia
Yeah.
fully. So you can just prevent the severity and prevent it from occurring early. So, like, I think we'll go to the next candidate, madam, if that's okay.
Okay.
So,
Yeah.
Dr. Roshni.
So
are
in
you
your
ready,
discussion
doctor?
in the exam, you also ask, how does your study compare with that of other study? Was it similar to the any other study was similar
Can
like
you want to
that? You all
comment,
comment.
Ragapriya, like what was your result comparison to others? Like, is it the same? Did you find it same to your study, like, you know, whatever the parent study is there, or did your conclusion differ from your parent study?
In my parents' study, oligohydramnios was also associated with abnormal urinary Doppler, ma'am. But I did not find any in my study. Maybe my
Okay.
sample size was low. I don't know.
Perfect, doctor.
Okay.
Dr. Roshni, are you ready?
Yes, ma'am.
Yeah, go ahead, doctor.
Yes, ma'am. Good evening, ma'am. Ma'am, my
evening.
topic is comparative study of HTP gestosis score, pregnancy-associated plasma protein A, and uterine artery pulsatility index in predicting preeclampsia, ma'am. A South Indian cohort.
Which college are you
PAPA,
from, Dr. Roshni?
I'm from Vijaya Hospital, ma'am.
Okay, fine.
PAPA, gestosis, and uterine artery
PI, ma'am.
gestosis
Yes, ma'am.
score. Can you just describe what you did?
Yes, ma'am. So I score all the patients, ma'am, based on the gestosis score. All the antenatal patients who are booked with us, either in the
At
early.
booking, when do you score them?
We score them. Actually, I'm scoring them thrice, ma'am, in my study. At the booking visit at 24 to 28 weeks and at 34 to 36 weeks, ma'am.
Okay.
That's because some parameters in the gestosis score, like gestational diabetes and weight gain, come up later, ma'am. So I wanted to compare the scoring at the 3 visits, whether there is any change, ma'am.
Okay.
And I also note down the PAPA, which we regularly do, ma'am, in our double marker screening, and uterine artery pulsatility index, which is done in the NT scan, or in case NT visit is not available, the anomaly visit pulsatility index, ma'am.
Okay. Either of the two.
What
Okay.
is it a prospective study or a retrospective?
Prospective, ma'am.
Sample size?
300, ma'am.
What is
Prospective.
the primary outcome you studied? The objective.
Yes,
Aim
ma'am.
of the study and
The primary outcome, the aim of the study is to predict the ability of HTP gestosis score in predicting the occurrence of preeclampsia by determining sensitivity, specificity, positive and negative predictive value, ma'am. And the secondary outcome is to also compare the ability of PAPA, uterine artery pulsatility index in the occurrence of preeclampsia and comparing that with the HTP gestosis score, ma'am.
They're taken on a lot. Which
Yes,
year
sir.
are you?
Second year, ma'am.
Second year. So you just started your data collection probably.
Yes, ma'am. I'm midway through it, ma'am.
Midway. Okay. Till now, what did you find? You'll have to follow them till delivery, right?
Yes, ma'am.
Okay. And what is your parent article tell us?
Parent article is from Jammu and Kashmir, ma'am.
Okay.
That tells us that the incidence of preeclampsia was 15.01 in their institute, ma'am, the percentage. The sensitivity of the HTP gestosis score was found to be 83.1%, specificity 97.5%, ma'am, with PPV of 85% and negative predictive value of 97%. Diagnostic accuracy was said to be 95.3%, ma'am. This was only the HTP gestosis score that was done, ma'am.
so you
And
are
this
going to
is-
compare these with it's a
The
three
pulsatility index
groups.
10. Yes,
So,
ma'am.
And what would you do if you find that the risk is high?
We put them on
intervention plan?
ecosprin 150 mg, ma'am.
See, you're doing this study over 3 trimesters. So
Yes, ma'am.
first, if you find the higher score, you will start earlier. What if you start in the second and the higher score gets higher in the second or third trimester?
In that case, if it's over 16 weeks, it's not proved to be beneficial to start them on ecosprin, ma'am. We just follow the patients up in that case, ma'am.
You just follow it closely. Close monitoring of the fetus, yeah?
Yes,
Ultrasound
ma'am.
Dopplers and stuff. Okay. It's an interesting study. So she's just doing it. Madam, anything? Very difficult to ask.
because she has to put lot of the statistical significance. You have to do a like t-test or a p-value. Then only we'll be able to know.
For each, they have to find out sensitivity and specificity.
of each in
For
relation
each
to
test,
that
she
of
has to
the
find out sensitivity and specificity.
Sensitivity and specificity of the Gestosis score.
Yes, ma'am.
And the other
No,
two
it's
parameters?
comparing.
Other two also I am
Yes.
taking the
comparing with the Papier and uterine artery
Comparing
Pulsatility index.
all three together or each one which is better?
Each
She has
one
put
we have to
separately.
find out sensitivity and specificity. And
One,
then
yeah,
only it will be a valid care.
Roshni, are you trying to find out at the end of your study which is better to predict
Yes,
preeclampsia?
ma'am.
Yes,
Yes,
she's
ma'am.
doing
Unless
individually, pa.
she is doing it separately, we cannot tell which is better, which is good, which is specific.
Madam, she is not very
See,
clear
few
about
tests can
her
be
primary outcome
sensitive.
here.
It cannot be specific.
Yeah. How do we do if it's just a sensitivity you give? How? I don't know. I'm at a loss here.
If there are 3 parameters, you put a t-test or something, and then you have to find out which is more sensitive, no? The statistician, yes. You have to do that, and she can tell us which is more sensitive. As madam is asking, Uma madam asking, if all combined together, will it be more thing? You need a large sample
Have you
size.
understood your subject well? Like basically, you know, how you are going to plan and what is the outcome you're looking for, and how would you be able to use it to prevent or no, predict early, later? Which of these 3 parameters would you use later to predict? Based on your previous article, the parent article or literature review, what did you
Yes, ma'am.
understand about this subject, Roshni? See, it is quite difficult even for us. You're not getting
Yes,
our head
ma'am.
around it.
Yes, ma'am.
Too many parameters. Ideally, we have to keep it as simple as possible. So if you're just stuck to Gestosis score, and if this is working well with our population and the sensitivity is good, we would stick to Gestosis score alone. Now we are using so many parameters. Already people have used PAPA and uterine artery PI. Now we are adding
Yes, ma'am.
the Gestosis score. Okay.
Yes, ma'am.
So you got to understand in your thesis, when they are going to examine, this is what they will want to know. How are you understanding this particular study? Even we are not able to get our head around it. At the
Yes,
end of
ma'am.
your study, what would you infer and what would you ask people to do henceforth? There should be some result which you will say, okay, if we do this, it is going to help us predict and we can try, we can monitor closely or start aspirin. All 3 of them together
Yes, ma'am.
taking is not going to work out. Individually, already PAPA, people have started using. Already uterine artery PI, people have started using. So the
Yes,
only new
ma'am.
thing is,
Gestosis score. Yes, ma'am.
okay.
Should we go to
Now
one?
you have to read up on it, the subject, because you will not be able to explain to your exam.
In the review of literature, what do they have inferred, ma? Score in Gestosis score is good as that is what she's trying to say. In places where they cannot have uterine artery pulsatility index or a PAPA, regular screening by Gestosis score will definitely help to predict preeclampsia.
Yes,
Is
ma'am.
it that what you are going to try to, what the review of
Yes,
literature
ma'am.
says?
There is another study, ma'am. That's not my parent article, but it says that the score, Gestosis score, is comparable to the other PAPA and uterine artery pulsatility index, ma'am.
It will not be a
Probably then,
single
if it
article,
is
ma.
so,
In a review of literature, you go through so many things. And
Yes,
majority of the literature, they may say it has been found to be definitely beneficial. Some say that comparatively is less sensitivity compared to that. So you have to try to give an understanding to us at the end of the day. Is it as efficacy as that of a thing or same or less? Like that, you should be able to tell us.
then probably
Okay.
we will be able to use it in the low resource settings. Just the score
Yes.
alone, if it is going to be comparable to the other 2, then in low resource settings, we need not make the patients go through all these
Another way,
Dopplers
I
and
thought
everything.
if it is going to be as a screening test initially, as a Gestosis score put at the first trimester, as soon as the patient has come, that will
Yes,
help
ma'am.
us definitely to take us to have additional tests like uterine artery is a mandatory. Like a initial, like just like fundal height, you see, if it is low, you think it could be a screening test for FGR. It is not a diagnostic test. So, Gestosis score can be as a screening at the initial visit itself. If it
Yes,
is
ma'am.
proven, am I correct? I don't know.
Yes,
She
ma'am.
has to come to a conclusion.
So Roshni, you should be very clear exactly what you want outcome from your study. What each of these parameters, how they're going to help you, and what would be the outcome you are expecting. You have to understand it in depth, okay? Because that is
Okay,
the
ma'am.
main thing they will expect when they are questioning you about thesis. You have chosen the
Okay.
subject, so how do you expect it to help you in the
Many
long
a
run?
time at the end of the exam, if everything is okay, they ask you, they try to find out really have you done this thesis or you have done in a fake way. So they ask you some questions and they finish it so quickly. I'm just telling what is their conclusion. Oh, hey, you have done it. You understand whether it's a randomized control trial or a thing, anything. Don't get disheartened. You are all doing well. What madam is telling, you should understand the research. That is what questions.
Mhm. It's
Yes.
very important. That is the main
Ma'am,
point.
okay, we'll move on to the last one, madam. Kavinila.
Dr. Kavinila, are you there? She's from SRMC, madam.
Yes, sir.
So this topic she's messaged us is dyslipidemia in pregnancy and the adverse pregnancy outcome. Dr. Kavinila, are you there?
Dyslipidemia and its
Our
adverse
pregnancy
outcome.
outcome, madam. Dr. Kavinila?
Okay, this seems new. We don't do tests for dyslipidemia.
Some of the antenatal packages which the patient come back from, madam, they have profile. Like some of
Few
the
of them, but not the reputed hospitals, not the maternity
do it
centers. If they go outside any lab, then they come with the entire set.
entire lipid
Ah.
profile. So maybe
And
like just
we
want
have to know the changes in pregnancy and what levels would be the cutoff here.
yeah. Kavinila, can you just like unmute or Kavinila, are you there? Dr. Kavinila? Because she said I'm willing to participate. Not there. Dr. Kavinila, are you there?
She could not able to unmute it, seems. She messaged me. Chitrakala, can you help her? She could not able to unmute it, seems.
Ma'am,
Vishnuta,
Kavinila?
do you have anything in hand? Vishnuta, if you
Yes,
could,
ma'am. Yes, ma'am.
Yeah.
can we ask Vishnuta to present?
Yes, ma'am. Yes, ma'am.
I'm Good evening.
Kavinila is talking, madam.
Kavinila is here.
Kavinilla has come.
Okay.
Good evening, ma'am. I'm Dr. Kavina from SRMC, ma'am. My thesis topic is dyslipidemia in pregnancy and seeing the fetal-maternal adverse outcomes, ma'am.
What's the type of study?
It's a prospective observational study, ma'am.
Okay. Over a period of?
A period of 1 year, ma'am. 2 years, ma'am.
Yeah. And the sample size and the
Sample size
exclusion criteria?
198, ma'am, sample size. Inclusion, all antenatal patients attending SRMC OPD and willing to give consent for investigation.
Exclusion?
Exclusion, multiple pregnancy, and already mothers having dyslipidemia or taking any other drugs on chronic hypertension, diabetes mellitus, known case of diabetes mellitus.
All the medical problems.
Medical.
Yes, ma'am.
Metabolic
ma'am.
disorders in the sense.
Yes, ma'am.
All the metabolic. So tell us, how do you do this methodology of this study? How do you go about?
I'm doing
What
it
are the
in
tests you do? How do you interpret? What are the cutoffs? Exactly.
this I'm doing in second trimester along with GTT, ma'am.
Okay.
When the patient is around 24 weeks, along with the GTT, in fasting, I'm taking 5 ml of fasting blood for analyzing serum lipid profile, ma'am.
Okay.
And I'm going to measure HDL, VLDL, triglycerides, and LDL levels, ma'am.
Okay.
And I'm going to follow up these patients till delivery. And during antenatal also, if she's developing any sugars, abnormal eye values, or BP recordings also in each visit, and mode of delivery, and fetal weight also, ma'am, whether low birth weight,
Fetal weight, whether they develop GDM, hypertension,
preterm delivery.
preterm delivery. Okay.
And
What is the cutoff for these patients? Is the same as the non-pregnant patients?
yes, ma'am. According to NCEP, HDL more than 40, LDL more than 110, triglycerides more than 150, and VLDL more than 130 I'm taking, ma'am.
Okay. And which is your parent article? What does it say? What is the conclusion there?
Parent article says there is association, ma'am. So if we predict early, we can
What
prevent
do you do if you find them to have dyslipidemia? Do you
Yes,
take
ma'am.
any special precautions?
No, ma'am, diet and
No.
exercise only, not drugs, ma'am.
Talk
Diet and
about
exercise.
inclusion, exclusion criteria, Uma.
Exclusion, already known case of
What is your ex-
exclusion criteria, multiple pregnancy.
exclusion criteria?
Already patient is no chronic hypertension or over DM, I'm excluding, ma'am.
Regarding thyroid is one of the
Obesity.
condition where you can have an associated
Hypercholesterol.
lipid abnormality. Have you
Ah.
thought about it?
Lipid.
Thyroid?
Others are any drugs she's taking for epilepsy, any steroid
No, no,
anti.
ma.
Madam
Yeah,
is specifying hypothyroidism.
Yeah.
One
Hyperthyroidism
association with
and obesity.
dyslipidemia.
I'll find out, ma'am.
You haven't.
Exclusion criteria, ma. Have you taken it along with the
Exclusion criteria.
Not taken, ma'am. All
Okay.
medical disorders I have taken as exclusion, ma'am. Patient with no comorbids are included, ma'am.
So
Any
she's not on
comorbid?
any other any other medicines. Yeah.
Yes, ma'am.
She's not
If she
specified hypothyroidism, ma'am. Are you excluding
Age inclusion. What about the age? All age group?
Yes, ma'am. All age group.
All
between-
gravida?
Yes, ma'am. All singleton women attending antenatal OPD willing to participate and give
Which age group to which age group you have included?
reproductive age group 18 to 45, ma'am.
So when you are
Women-
analyzing in the age group also, whether it has any relation with that of dyslipidemia,
Yes, ma'am. Obese and more than 35.
they are the confounding factors, no?
They are having
Previous, what about the previous history of PCO?
yes, ma'am, we're not excluded, ma'am.
PCO, the hypothyroidism and all, she has not taken them.
Okay, what is your perinatal outcome in such
Yes, ma'am.
cases when there is a dyslipidemia?
Yes, ma'am. I'm going to see the UPSCAR score and preterm delivery, any baby NICU admission. Preterm delivery is there
No,
only.
no. What is the impact on the newborn? If there is a dyslipidemia, any impact on the newborn?
Yes, ma'am. The patients are more prone for GDM, ma'am. Babies are LGA, ma'am. Macrosomia and 1 day NICU admissions are more, ma'am. NICU admission for CBG monitoring.
So the underlying dyslipidemia causes GDM. That's your
Yes, ma'am.
hypothesis?
Yes, ma'am.
In the review of literature, and have they, what all they have studied for dyslipidemia leads on to what are the outcome they have studied?
For development of preeclampsia, gestation diabetes, and preterm delivery, ma'am. 3 outcomes I'm seeing, ma'am.
3 outcomes.
Yes.
The
So
women is
your
on,
aim also
women is
to,
on thyroid and all, you have not taken into account if the patient's on thyroid medication and all.
No, ma'am.
Okay.
Okay, just an observation.
previous
Madam. At
history
the end
of
of it, she
PCOS.
just tell what she saw. And then later, future research, they have to go
Yeah,
in
which
detail.
year she's doing it? Say first year?
Yes, ma'am. Just entered for second year, ma'am.
Oh. Still more, you do some research
Okay,
review of
ma'am.
the literature. Okay, then you will have a better idea. What's your,
Okay.
you can still, ethical clearance have not obtained, no?
Obtained, ma'am. They've given, ma'am.
You can add certain parameters if along
Add
the
your-
way you go see some other interesting outcomes or anything, you can add it on.
Outcome you can add.
Okay, ma'am. Okay.
Okay, thank you.
Thank you.
Deepa ma'am.
Anyone else want to? We
Uh,
have time for anybody else to present?
Ma'am, we'll finish it off, madam. We'll have a short quiz for 10 minutes. So
Okay.
already it's 8:30. And
Okay.
I want you to give final advice from each one of you to the candidates who was approaching for the thesis presentation, madam.
Exam,
Yeah.
madam. When you want a thesis discussion in exam, as an examiner, like what are the points you want to tell? Like what are the points they should know for the when they before coming to the exams regarding their
First thing I would like to reiterate again and again is first understand your study properly. All of you, when they ask you what your study is about, you should be able to clearly say what you're going to do exactly, what is the outcome you expect or the outcome you're trying to get from your thesis, what you expect to do after getting a particular outcome. But mainly, they need to know that you understood what you're doing, how you're going about it. Okay, most of you don't even know like the subject. You're giving us a topic, you're telling us a sample size, you're telling us who is included, who is excluded. But when we ask you to explain what exactly you're going to do, what the nuances of the topic, you should go in depth and study many articles related to your subject, and you have to go prepared for that, questions based on that. That's the main thing everyone expects, whether you understood what you have done and why you have chosen that particular topic for research.
Two things only, ma. You should know what is a research question, what is a research objective. Research question is what you want to find out. That is your aim. Objective is what you will do to analyze that, to answer this question. So you have a question and you want to answer that. What will you do? That is the thing. Two, objective and question. That you should be very clear. So my research question is that to find out whether uterine artery pulsatility index is going to increase the outcome. For which, what is the methodology I'm going to do will be your objective. I think.
Let's see, madam. Any final words of wisdom, madam? Madam.
And what they are doing, it simply they cannot say my objective and all that. If they get involved and do it, definitely they can spell out very easily. And that outcome, they should they should know about the outcome because they have already analyzed. When they come for exam, they would have done the entire study. Now they have not done the study, they are halfway through. So the outcome and whether there is a possibility of future development also, they should think about it. Even in their research, in the dissertation, there is one column they can add, future development. So then it will be interesting.
Limitations of
they
the study
shouldn't
also they
fumble.
should know.
One word of advice,
so
after you all finish your thesis, actually we give it away and we keep it in the cupboard. Don't forget to go through your thesis before your exam. Read it once from first page to the last page because we cannot remember everything we did. The moment it is done and the board approves, we are so happy we pack it away. So before you go ahead for your practical exams, take out your thesis dissertations and read it from front to back. Go prepared to give any answer. It's a very important part of your
summary
Viva.
you have to read. Summary, if you read, then everything is included there. And when you talk fluently, then they will stop with so many questions.
Yeah.
If you fumble only, they'll keep on asking you and dig your grave.
They should know the
Okay, all the
limitations
best,
of their
Ma.
study
All of you
also.
have done well.
Thank you, ma'am.
Good.
Thank you, ma'am. That was an excellent advice for the PG students. They will be very much prepared for the thesis examination presentations
We should
for the
have practice
examination, madam.
examinations for them.
Yeah. It was like a real examiners this time. Thank you so much for your time. Thank you, Epsima madam. Thank you, Prema madam. Thank you, ma'am.
Thanks
Okay.
to you all. It was
Thank
fun.
you, ma'am. Yeah.
Thank you.
This quiz is for everyone
Thank you
here.
so much,
Yeah,
madam.
everyone.
It was a very excellent session. Premlata ma'am, Hepsiba ma'am, Uma ma'am, Deepa ma'am, Priya Kannapan. Excellent session. It was very, very interesting.
Yes,
And
Meena.
all those
Thank you.
participated also.
Yeah. So next we will move on to the final session of this webinar. I may invite our quiz masters, evergreen quiz master. So over to you, Priya.
Yes, ma'am. So, is my screen visible, madam?
Yes, ma'am.
Okay. So I'm like going on the Kahoot. Okay. Yes. So today's quiz will be more about research, maybe a little about all these classification, named scorings because I didn't know what all research we should have. So I kept it like, what all I thought it's important for the PGs. So I will start my quiz. So my loading, my game pin is loading. Just give me 2 seconds. So either, yeah, this is the loading pin. Yes. I'll switch off, maybe I can reduce the sound. Yes. So if you have a Kahoot app, you can go enter this game pin 400446. And if you have a phone, you can go to your Google, open your camera and just take a picture of this QR code. Okay. Or otherwise go to www.kahoot.it and then it will ask for your gaming pin. Just enter the gaming pin of 400446. So we'll wait for people to join. So maybe you can give your full names as well, so that if you win your, like when we display your your institute HODs are going to be happy, saying that, see, my candidate has won the quiz. So please, you can give your at least a little bit of first names, full names. So we'll be happy to call you by your names.
So that's a nice way of telling, Priya.
Yes, ma'am. Usually you feel happy. And actually, if my PG wins, I'm like really happy and saying that, hey, my PG is coming first. Same thing, I think every department, I think
Correct.
madam will agree with me since Uma madam is here. So if her PG comes, so madam will be like literally, I think even Premlata madam will be there.
Yeah, my PG is here. I'm hoping to
Okay.
join.
Yes, pa.
So we are like, only the consultants are, exceptional to not give names, but for PGs, we really want your names to be there so that, we'll just give it to your HODs and we'll make them proud.
Super.
So we have more people. So 13 have joined. I'll just give you another 2-3 minutes so that we'll not waste much time. It's a very simple quiz. I have very limited questions. I think I just have 21, 22 questions overall. So, and few are very simple. You can even feel that why this kind of simple question is there. But I think, sometimes you need to know the simple quiz as well. Sorry, I think my Kahoot is.
How to join the layer?
Sorry, madam, one moment.
Priya, your Kahoot screen is not visible.
Sorry, ma'am. Yep.
Yeah, now it's
There 16 of you have joined. So kindly, all of you join.
it's almost 33 people are there.
So yeah, at least 20, 25 is the number we are looking forward. So I think another 1 minute I'll give you. If you're not joining, then we will just go ahead and start it. Because once I start the quiz, you'll not be able to join. So that's why I'm waiting. Please, whoever is joined, please don't leave this platform because we want you to be there. I think at least the presenters who can come and join, Kavinila who was there, maybe she can join. So thank you, Roshni Balaji, who have joined already. And anyone who's willing to join, please join fast. Dr. Kausagi, I saw a few of your names. Anyone having any difficulty? Please 16, my number is not moving. Anyone joining? No more, then we will start the quiz. You can message us. You can message us in the chat group as well if you're finding it problem. Madam, any messages there?
Message I have put only 35. May not able to join. Anusha could not able to join.
Ma'am, I'm also unable to join, ma'am. Kavinila.
Anusha Gautaman not able to join us. One more person spoke now.
Yeah, don't leave the Zoom platform. Just wait in the background. Go and open your Google Chrome. Enter kahoot.it, www.kahoot.it, and enter the game pin. It's very simple when you go through the Google browser. You need not go into the app. Okay, just go into the Google browser. Okay, the moment you put it as kahoots.it, it will ask for the game pin. Just enter that. Okay, are you able to do that with that now? 18 have joined. Yes. Kabinila, are you able to join now? Just leave the Zoom in the backdrop, the background. Just don't exit that also. You can just leave the Zoom, like go out, take the Google browser. So shall I start? It's 19 now. So anyone trying to join?
Ma'am, I am unable to join, ma'am.
Who's it?
Kavinila, ma'am.
Can you just, I don't know, because through the Kahoot you can join. I mean, what is the difficulty you're facing?
I'm not able to connect, ma'am.
Is it
20
something?
have joined, pa.
Yeah, 20 have joined because, I think your network is poor or something,
Yeah,
doctor?
Priya, that's QR code. We can able to Google that QR code and then we can join. Is
Yes, you can. You take
Kavinla, you can
phone,
try that.
You take your phone, okay, but are you like connected through the phone here in the this one, huh?
For phone only, ma'am.
Phoneல தான் பண்ணனா அப்புறம் QR code வந்து திருப்பி இதுல பண்ண முடியாதுல. You need to screen the QR code லப்பா.
ஸ்கிரீன்ல இருந்து பண்ண முடியாதோ?
QR code phoneல இருந்தே அப்படியே டைரக்டா கனெக்ட் ஆகாது மேடம்.
ஓகே.
QR கோட கூகுள் லென்ஸ்ல ஸ்கிரீன்ஷாட் எடுத்துக்கோடா, ஜூம் பண்ணி அதுக்குள்ள கூகுள் லென்ஸ்ல போயிட்டு ஒரு லிங்க் ஓபன் ஆகும். அந்த லிங்க் ஓபன் பண்ணினா
இன்னொரு
கஹூட்ல
டிவைஸ்
ஜாயின்
வேணும்.
ஆயிடும்.
இன்னொரு டிவைஸ் இருந்தா you can take it. If you have an iPad,
இதுலயே எடுக்கலாம்டா. இதுலயே வந்து you can enlarge. கவினிலா கேக்குதா? கவினிலா,
Yes, ma'am.
நீ வந்து அப்படியே வந்து இன்க்ரீஸ் பண்ண ஸ்கிரீனை ஜூம் பண்ணி ஸ்கிரீன் ஷாட் எடுத்துக்கோ. அந்த ஷாட்டை வந்து கூகுள் லென்ஸ்ல போட்டேன்னா அந்த கஹூட் வரும். அதுக்குள்ள வர லிங்கை கிளிக் பண்ணேன்னா நீ உள்ள போயிருவ.
Okay, ma'am.
Should I wait or shall I start, madam? Deepa, madam?
Wait for Kavinila. There are 37. Only 20 have joined.
Dear
Few
PG,
minutes.
join. Please don't leave it.
It was an interesting trials you have collected. So
These
I
are
just
all
want
the important things which you have to know for your exams. So there is nothing unusual I've taken. I would like, most of the questions I've even asked few of my colleagues who are there in that specific field. What is the recent trial? So everything which you have to know when you're going for exam. So these are the a favorite questions for examiners, especially when you do really well, then you'll go into all these questions on trials. So, and I mean, I think as a PG, you have to know certain trials. We cannot go without trials. I think all my examiners today will agree with me. Certain trials they have to know.
23 has joined, Priya.
Yes. So,
okay. You can start. I
madam.
think you can start, Priya.
Yes, madam. So,
ஜாயின் பண்ணிட்டியா கவினிலா?
இல்ல மேம். ஓகே மேம், என்னால ஜாயின் பண்ண முடியல. இட்ஸ் ஓகே மேம்.
ஸ்கிரீன்ஷாட் எடுத்து அதுல போயா உள்ள கூகுள் லென்ஸ்ல அந்த ஸ்கிரீன்ஷாட்ட இது பண்ணேன்னா அதுக்குள்ள போயிடும் உனக்கு. இல்ல பக்கத்துல போன் எடுத்து பண்ணு.
ஓகே மேம். பட் என் போன்ல வெறும் எல்லாரும் பேசுறதுதான் மேம் வருது. அந்த மெயின்
okay, no issues. It's okay at least, but you can stay back and know the questions. So, madam, I'm starting. Okay. Yeah. Dave, join பண்ணவங்க வெளில போகாதீங்கப்பா. Then once I start, you'll not be able to rejoin back. Okay, it will just hardly take 10 minutes. So let us finish it up now. So no, I'm like, I don't want to leave any more people because everybody's leaving. So I've started the quiz. So this is the quiz. Yeah, we are going to start. Most of it is on research articles. Simple question. CHIP trial is on. Is it chronic hypertension in pregnancy trial, control of hypertension in pregnancy trial, clonal hematopoiesis of indeterminate potential, chromatin immunoprecipitation? Okay, I will reframe it, whatever is there in our option guide. We are not talking about other things. Exactly, it is not chronic hypertension, it is control of hypertension. So that's why I put that. And your chronic hypertension and pregnancy trial is called as, anyone? CHAP trial, chronic hypertension and pregnancy, CHAP. So this is CHIP is for control of hypertension. The other two CHIPs are there, but it's not related to obstetrics. So we'll go to the next question. So Dr. SR is there on the top. So the next question is MIG trial is metal inert gas, medical inoperability, metformin in gestational diabetes, measles immunoglobulin trial. Okay, please don't click the screen there. Okay, yes, thank you. But Dr. Vishuddha, please don't click the screen there. Sometimes it is like, disturbing for others. Yes. So all of you are correct. Thank you. And the missile was there because there is one MIG with missiles also. So Dr. SR remains the same and Dr. SN and Roshni are there. Good guys. So like next, continue with the next question. As per trial conclusion is that aspirin 150 milligram should be started at 12 weeks, prevent preeclampsia in all. And in high-risk women, it prevents severe preeclampsia. Aspirin in high-risk women prevents preterm severe preeclampsia. Aspirin in high-risk women, prevents preeclampsia. So whether it prevents preeclampsia, severe preeclampsia, okay, most of you are correct. Yes, it prevents preterm severe preeclampsia. Very good, guys. So you have understood what is that. So lovely. There is a change in the scoreboard. Yes. And Dr. S.R. Roshni, Jay Lalit, nice with Dr. Ruchita and Fari. Very good. So next we are going to go. Truffle trial is on which condition? Truffle. Is it on preeclampsia, FGR, hypertension, thalassemia? Truffle trial. Wonderful, wonderful, guys. Wonderful is the use of uterine artery Doppler in FGR. So lovely, very good. So next we'll go. So Dr. SR remains the same. Yes, and the scoreboard is pretty much there. Very nice. So the wrong statement regarding PERT is, okay, it is a pre-eclampsia ratio test. Is it SFLT by PLGF ratio? It is when the ratio is less than 38, is associated with low risk for preeclampsia, and it is done before 12 weeks. Okay, it is like, yes, the ratio when it is low, it is the low risk for preeclampsia. That's the correct statement. And it is not done at 12 weeks. Actually, it is done at 20 weeks or at least after 12 weeks. It's definitely not before that. So wonderful. Scoreboard is pretty much the same. Yes, Dr. Balaji and is climbing there. Very nice, guys. Next question is RNA silencing therapy is being explored as a treatment of which condition? Is it gestational diabetes, preeclampsia, any congenital anomalies, or recurrent pregnancy loss? RNA silencing therapy. Okay. Actually, if you would have come to today's preeclampsia update, it was mentioned by Dr. Jayam Kannan, the RNA silencing therapy is a study is done for preeclampsia. So the next question, so the scoreboard remains the same because nobody got it correct. Sweet score is for which disease? Is it for hysteroscopy? Is it for ultrasound? Is it for colposcopy? Or is it for histopathology? So sweet score is for which condition or like, which diagnostic test uses a sweet score? Wonderful, guys. Wonderful. It is a colposcopic scoring to give you whether it is CIN or whether it's normal or abnormal based on all your findings. So scoreboard, Dr. SR remains the same and Dr. Balaji and SN are climbing. Very nice. If you put your whole name, I could have called you by that, but short forms are a lot of there. So very good, guys. Next time, full names, please. Sapporo's criteria is for which condition? So, Tucker, SLE, AFLP, APLA, ITP. Wonderful. You hardly took 5 seconds for that. And excellent, guys. Excellent. So most of you are correct. So fastest tuckle. Oh, very nice. And Balaji is climbing, and Anisha, good. You have come to the top 5. So the criteria for HELP syndrome. Is it the Mississippi's criteria, Tennessee's criteria? Both A and B are correct. None of the above. So lovely, wonderful. You know very well. Both are for HELP syndrome. Wonderful, Dr. Balaji, for climbing to the top, and followed by Dr. VR and SR. Good, guys. So which is not a classification for prolapse? Okay, is it Shaw's classification, Bader-Walken's classification, Delancey's classification, Popkew's classification? This some questions, so I hope still some examiners like to ask this question. Even after like 15, 20 years, they really love that. Lovely, because Delancey's classification or Delancey is about support of the pelvis, and it is not about prolapse classification, and all other 3 are correct answers. So Dr. VR is climbed up, and yes, Dr. MM and Anusha is also climbing up. Lovely, guys, lovely. So the step W classification is for classification of adenomyosis, classification of a polyp, classification of postmenopausal bleeding, identify the root of submucous fibroid surgery.
Step root.
Wonderful. So the steps you have, like, their size, how the, echogenicity, and how the, like, how it looks, and all those things you put into a classification. And if you feel whether the surgeries can be done through hysteroscopy, and if the score is higher, it has to be done through laparoscopy. So that is how you use the step W classification. It is for submucous fibroid and not polyp. So excellent, guys. Excellent. So the scoreboard, yes, Dr. Itishri has come back, come to the score now, and Dr. Balaji is back. And VR is the top. So next, we'll go to the next question. The tool which used to predict the likelihood of natural pregnancy in the women with endometriosis is the ASRM staging, the EF5, the AFS staging, all the above. Wonderful, wonderful. But you are like, not all the above. We know whether the patient has to undergo a natural pregnancy or a patient has to undergo an IVF is based on the endometriosis fertility index and not the ASRM or the AFS staging. So this is the definition for your EF5. That is, it predicts the probability of natural pregnancy. So we'll see the scoring board. Wow, Balaji is climbed back to the first place, followed by VR and MM. Very good, guys. Excellent. Triple P procedure is for placenta previa, placental abruption, placental accreta, or ruptured uterus. I would have allowed it, the baby would have danced. Okay. Wonderful, guys. It is for placental accreta syndrome. Lovely. Triple P procedure. Wonderful. Score remains the same. Balaji, here, MM. Very good. For staying back in the top 3. Swansea's criteria is for which disease? Is it for ICP? Is it for APLA? Is it for the HELP syndrome? Or for the AFLP? Nothing to do with this one. I could not get a picture. Most of you are correct. Yes, it is AFLP. Lovely, guys. Lovely. So the scoreboard remains pretty much the same, and Dr. Itishri has come back to the top 5. Good, guys. Good. Puke score for severe nausea and vomiting of pregnancy is less than 7, more than 10, more than 13, 15. Okay. Wonderful. It is 13 to 15, or if at all you say any score more than 13, and the total score which is available is 15. So, more than 13 is the correct answer. So pretty, yes, Dr. VR, congratulations to Kaimbab, Dr. MM and Balaji. Lovely, guys. Lovely. So the next question, We still have just 4-5 questions. Trust trial is for. So trust trial is for ovarian cancer, endometrial cancer, cervical cancer, or vulval cancer. Easy peasy question. Able to get one correct. Okay, it is for ovarian cancer. It is nothing but a treatment of radical upfront surgical therapy in ovarian cancer. Okay, radical upfront surgical therapy in ovarian cancer. So let us go back to the scoreboard. Dr. M.M. is climbed, followed by Dr. VR and Balaji. And Dr. Jayalalit has come to the top 5. Okay, good. So LAC trial, LACC trial is for cervical cancer, ovarian cancer, endometrial cancer, vulvar cancer. Wonderful, wonderful. So LAC trial is laparoscopic approach to cervical cancer. And this is an iconic trial because this trial told that if you do an open surgery, the survival is better compared to laparoscopic surgery. And this created a lot of things. And people went back, they disproved this trial stating that this was like, a senior junior difference was there. And that was a reason for survival difference and not the surgery per se. So this was in between. They said you should not do laparoscopy at all. So an iconic study you have to know. So wow, MM is there, 11 in a streak, wonderful. Followed by Dr. VR and Balaji. Kindly give your full names once you win the quiz. So we will tell you from which institute as well. So thank you. And still we have time. These 4 questions. PRISM trial is for progesterone in preterm labor, progesterone in early trimester bleeding, progesterone in RPL, progesterone in IVF. So we know it's for progesterone. So there's no point in telling that, whether it is anything else, it is progesterone. Yes. So in which of the indication do you think progesterone? Oops, sorry. It is progesterone in early pregnancy. So Dr. MM still stays in the first. Promise trial is regarding. Promise trial, is it regarding labetalol, metformin, propes, or progesterone? Simple question. Yes, promise is for progesterone. Okay, the scoreboard remains pretty same. And yes, congratulations, Aish, for climbing on the top. So we have only 2 more questions. TP divided, that is true positive divided by the true positive plus false positive, called as sensitivity, specificity to predictive value, likelihood ratio. Some amount of statistics you should know. Okay. True positive by the total amount of positive is positive predictive value. True positive plus false negative if you put it sensitivity. Good. We are going to see the scoreboard. It remains pretty much the same. MM and Balaji are staying there. L is for easy question. Occipital posterior, face presentation, breech presentation, twin pregnancy. Wonderful, guys. Wonderful. It's a term breach trial called as Hana's trial, iconic trial, which came and said, if you're going to give normal delivery for a breach, you're going to get complications. Yes, Dr. MM, congratulations for staying in the fun. Last question. HAPO trial is for just a simple question. Diabetes, hypertension, hyperemesis, high-risk pregnancy. Lot of H's. Wonderful. I thought most of you will get confused with all these H's. Yes, it is hyperglycemia associated pregnancy outcome. So it is for diabetes. So we are going to see the scoreboard. So number 3, we have VR. I would request you to give your name there. And number 1, we have Balaji. Congratulations, Balaji. And we know Balaji is from Southern Railways. And we have Dr. Aishwarya and Jayalajit as runner-up in 4 and 5. So congratulations. I would request all of you to please put your names in the, chat box with the college which you're there. It will be kind enough if you can do that. So I am stop my share screen. So Dr. Deepa madam, are you there?
Yes, it was very, very nice, Priya. And I have to thank all the delegates who stayed till now.
Very
and
nice,
please don't be putting your full
very
names.
nice quiz, Priya. It was very good.
Thank you, ma'am.
Enjoyed it. Enjoyed it very well. Very well.
Aishwarya
Again,
from
students.
Kerala Institute of Medical Sciences, Trivandrum, excellent. Dr. VR is Vijayalakshmi from IOG, very good. And Dr. Balaji from Southern Railways, yes.
Priya, na MM name I joined, so you remove me and put fourth position as third. I just wanted to do your Kahoot, so I joined. I joined in MM.
Thank you. I'm honored. I'm very happy that a student has joined my quiz. Thank you.
So, it was very, very nice.
Who is your mom?
So I
Who is
joined
your
you.
mom? I
Please
can't
move it as
understand.
Meena Mahalinga.
madam.
Oh,
Meena
நீங்க தான் join
Mahalinga.
பண்ணீங்களா?
So I like her quiz, so I joined, madam.
Who was
You
the
please
fourth
move
place?
fourth place as third place move பண்ணிருங்க.
Yaar
Third
fourth
second
place?
move பண்ணிருங்க. You answered no one name.
Actually, I saw that one was Aishwarya.
is Vijayalakshmi. Aishwarya and Vijayalakshmi. அவங்கள போட்டுருங்க.
Aishwarya and some
Jayalalitha-வா?
ஆமா அதுதான் நினைக்கிறேன் அவங்க தான் லைக் அதுல யார் 4ன்னு தெரியல பிகாஸ் அது டக்குன்னு போயிடுச்சு எங்க ஹூட் ஸ்கிரீன்ல
ஐஸ்வர்யா
அவங்க
தான்
ரெண்டு பேருக்குமே போட்டுருங்க. ஐஸ்வர்யா ஜெயலலிதா ஸ்கோர்னு போட்டிருக்காங்க.
ஆமா so Jayalalitha is 4 and Aishwarya is 5th but very nice guys top 5 is also
excellent and I think postgraduates have really learnt lot of points எல்லாருமே within a short time 10 minutes to learn all the trials and to remember it's very very difficult and this will be excellent learning, that's what I can say. As we climb up to get a gold medal or whatever, these trials will be the designing point in the afternoon sessions. So really great and difficult to learn everything one by one. This will be easy to remember as we have Priya has dealt everything in detail. Easy.
Congratulations, Deepa and
Congratulations.
Priya and all the candidates. It's a very nice thing. Thank you.
Excellent section.
Jayalalitha,
Deepa. Thank you, Premlata ma'am. Thank you, Shri Events for the link and Uma madam for staying back.
Everyone. Enjoyed the session.
Thank you so much,
Madam, thank
Uma
you.
ma'am.
And I would really like to thank on behalf of Oxy. Thank you, Meena Madam, for joining and staying till the end. And I would really like to extend our thanks to Dr. Umaram Madam. She's not in town, otherwise she would also joined us. She's one of our co-chair for the Clinical Research Committee. And Dr. Deepa Stangmani, and this is the fruit of Dr. Deepa Stangmani's idea. So we just worked on that and it really turned out well. So if Dr. Jayalalit can tell us from which college, we'll be more happy. Jayalalitha, I mean, if we are not there, then I think we'll close.
She's there. Jayalalitha is there.
Yeah, she's there.
Unmute பண்ணி எந்த காலேஜ்னு சொல்லுங்கப்பா. They'll announce the results in the group. It's a pride for the college. Jayalalitha, are you there? Karthika Gautam is from Chengalpet. Kavinila is from Ramchandra.
Yes, ma'am.
I think they all can introduce and get get friends with each other.
Hello.
Very nice.
Thank you,
Jayalalitha. Thank you, Deepa ma'am.
Thank you, Meena.
Thank you, Priya. Thank you. Excellent session, madam. ரொம்ப இன்ட்ரெஸ்டிங்கா இருந்தது. It was a nice learning.
We thought of a different meeting for the clinical research, Meena, this time. Okay, so we want the student involvement. That's why we changed it into like a thesis discussions, a research discussion kind of thing.
I hope all the students
Hello,
will
ma'am.
Madam. For
Hello,
students,
ma'am.
Yeah, Jayalalitha,
it's a
right?
difficult
Ma'am,
topic, madam.
I'm from
Explained
Sundaram
very,
Medical
very nicely.
Foundation, ma'am.
Oh, lovely. You could have told us no more, madam. would have
Ma'am, I was trying to unmute, ma'am. It was not unmuting, ma'am.
so
That's why
that's
I was
why
not able to.
thank you, Dr. Always put it in the chat box. Thank you, Doctor. Thank you.
Thank you, ma'am. Thank you very much.
Thank you.
Okay, ma'am. So we'll finish for the day. Thank you for everyone to join us. We'll just meet you in the next clinical research committee meeting with such another interesting topic and interactive quiz session as well. Thank you, guys.
And
Thank
also
you.
request everyone to register for the postgraduate revision course. It will be a useful one. We have all brought all the excellent teachers and they'll come as examiners really. So you please make use of it and it will be very nice. We are trying to organize in a great way. Please join us.